Hello, my name is Greg Dehmer, and I'm going to speak to you today about a new document that has just been released. It's the 2014 Expert Consensus Document on Performing PCI Without On-Site Surgery. SCAI published a similar document in 2006. A lot of things have happened since 2006, so we felt that it was time for an update. We collaborated with the American Heart Association and the American College of Cardiology to produce this new document. What we do in this new document is we outline the current trends that have happened in PCI. I think everybody's familiar with the fact that PCIs have gone down in number, similar to what we've seen in bypass surgery. There's a lot of reasons for that, but numbers are going down. Facilities are doing less volume, and therefore it is ever so important that high-quality standards are maintained. What we did in this document is we looked at all of the literature that has been published since the earlier document. There's about 12 studies that have been published out there, but the two most prominent are the only two randomized trials of elective PCI without on-site surgery, specifically the C-Port elective trial and the MSCAI trial. Both trials reached similar conclusions, and that PCI without on-site surgery was safe. There was no increase in mortality and no increase in the need for emergency bypass surgery in either of those randomized trials. It's important to emphasize, however, that those were very carefully controlled trials with very strict entry criteria. The operators were very experienced in doing PCI without on-site surgery, and the facilities that they worked at were very dedicated to following the protocols. In addition, what we do in this document is we look at all of the major publications or guidelines, competency documents, expert consensus documents that have weighed in on the practice of PCI without on-site surgery. That includes the 2011 PCI guidelines, the 2012 expert consensus document on cardiac cath labs, the 2013 competency document on coronary intervention, and several other documents that are out there. For facilities that are engaged in PCI without on-site surgery, it was difficult to look at all of these different documents and try to pull it all together. So I think one of the most important things we've done in our document is to bring all of this information into one resource. And there's a number of tables there which have consolidated all of the recommendations, and we make a few new recommendations which are also in the document. I think this just emphasizes what individuals in European countries and really worldwide have been practicing for a long time, and that is that PCI without on-site surgery is a safe thing to perform, but it must be done under very stringent rules, very strict operating conditions by individuals that are well-versed in this and dedicated to doing a good job for their patients. This document will be published in its entirety in CCI, and it's also going to be published, co-published in several other journals. We're planning to do a much more extensive webinar on this topic, and that will be available shortly. So I hope that you enjoy reading the document. We'd certainly be interested in any feedback, and we hope that you find the document helpful to your practice. Thank you.